Hello, I'm Dr. Michael Teplitsky. I'm a medical doctor practicing internal medicine, holistic, and alternative medicine in New York for over 30 years. Today, we'll be talking about osteoporosis. It's a condition affecting over 50 million people in the United States, mostly postmenopausal women, and I'll explain to you why. Osteoporosis literally means porous bones. They're weak, they're brittle, and they're more likely to break. There is another term that you might have heard. It's osteopenia. It means weaker bones. It's sort of an intermediary stage between normal and osteoporosis. So people with osteopenia eventually go on to develop osteoporosis. You need to know that a bone is a living tissue, just like a muscle. So the body is constantly remodeling it. It builds new bone constantly and removes old bone. When you're young, the body builds more bone than it removes. So the end result is the increase in the bone mass. And then at a certain point, when you're 25 or 30 or 35, you reach the peak. And then you start removing more bone than you make. So the net result is the bone loss. And this is what leads to osteopenia and osteoporosis. And the process accelerates in women after menopause. The problem with osteoporosis is that it can lead to fractures, to breakages. The two most common areas where the bones break are the hip and the spine. Hip fractures are dangerous. They require surgical intervention. They very often cause death, and many times they result in total incapacitation, so people end up having to live in a nursing home for the rest of their life. Not exactly a very desirable fate. Fractures of the vertebrae or spinal fractures lead to loss of height, to humps, and to back pain. Osteoporosis is a kind of a silent disease. You don't know that you're getting it or that you're having it because there are no symptoms until one day, boom, there is a fracture. But what we do know is that everybody's bones become weaker as they get older, especially if you're a woman, especially if you're a postmenopausal woman. So we don't need to worry about symptoms. We need to worry about how do we make those bones stronger. I'm sure you've heard that you need a lot of calcium to make bones stronger. This is true. You do need a lot of calcium to build bones, but it has to be the right sort of calcium. Most of the calcium supplements that are out there are dead calcium, calcium carbonate. The chalk that you use to write on a blackboard is calcium carbonate. Marble, limestone is made from calcium carbonate. You don't need that kind of calcium. In fact, there are studies that show that this kind of calcium actually increases the risk of heart disease. You need live calcium, calcium that comes from food. But even if you get lots and lots of good, healthy, live calcium, it's not going to be enough. Just like you cannot build a building just from brick or stone alone. You need other materials. Similarly, to make bones, you need 20 to 30 different materials, other minerals like magnesium, potassium, phosphorus, silica, vanadium, zinc, many others. And what your body does, it combines all these things to create a material called microcrystalline hydroxyapatite. That's what the bone's actually made from. Microcrystalline hydroxyapatite. Now, you'd be better off if you could eat bones. Then you would get everything that your body needs to make your own bones. But we can't eat bones, unless, of course, you eat canned small fish like sardines with bones. Then, yes, you will be getting bones. But other than that, your best bet is to take the supplements of this microcrystalline hydroxyapatite. I use the one made by Douglas Labs. I found it to be better than similar supplements from other companies. But in addition to microcrystalline hydroxyapatite, you also need vitamin D and you need vitamin K. Now, vitamin D we're supposed to get from the sun. If you're exposed to the sun, you're supposed to make a lot of vitamin D. Most people don't have enough vitamin D. You can check your blood level and you will find that it's probably low. I see people with levels quite low, inadequate. A normal level is supposed to be between 50 and 100, and I see people with levels of 2 or 3 or 5 or 10. So check your level, and if you don't have enough, then you should take vitamin D supplement. You also need vitamin K. We don't get enough vitamin K from food. Vitamin K is found mostly in greens, and that's why many people don't get enough, because we don't eat enough greens. But you can buy vitamin K in a health food store. It's usually a synthetic one made in the laboratory. The one that I use is actually a natural vitamin K. It comes from the butter, which is made from the milk produced by the cows that eat grass. There is vitamin K in grass, so the cows, when they eat grass, they accumulate vitamin K in the fatty part of the milk, because vitamin K is a fatty substance. And then there is a company that makes a supplement from the fatty part. They call it butter oil, and it contains a lot of natural vitamin K. There are many medications that can accelerate bone loss. For instance, steroids, antacids, because you need acid to absorb minerals like calcium and magnesium and so on. Certain cancer medications, certain water pills, many others. So you need to be aware that if you're taking any of those, it may actually accelerate your bone loss. But probably the most important factor in this whole discussion is the hormones. Estrogen, progesterone, testosterone, DHEA, they're all very important for normal bone health, because they stimulate and support the cells that make the bones, that create the bones, that build the bones. That's why young men and young women have strong bones, and that's why old men and old women do not have strong bones, because their hormone levels are way down. Now, I have a separate video about how to compensate for this hormonal drop in older men and older women, natural bioidentical hormone replacement. Please look these videos up. For now, I just want to summarize it very briefly. Young women have very high levels of hormones. After menopause, these levels should drop to about 10% of what they used to be, but in many women, they drop down to 0. I've seen hundreds of women with levels of 0. And that's not good, because you need a 10% of what it used to be to support the brain and the heart and the immune system and the bones. Without this level, your bones will become weaker. And it is because the hormones drop so low, so many women have hormone related symptoms like hot flashes and night sweats and so on. So again, I have a video about how to do natural bioidentical hormone replacement therapy. Bioidentical means natural, exactly the same as your body would produce, so they do not carry any particular higher risk, and they provide the same level of support as your own natural hormones. So if you're a woman going through menopause, approaching menopause, or having gone through menopause, and you're concerned about your bones, don't rely on all these medications that you hear advertised on TV. They don't do anything. They don't make your bones stronger. Just look at the side effects and you see what are the side effects is the fracture. How can they make the bones stronger if they cause fractures? So forget about that. You need to ask your doctor to check your vitamin D level. and you need to start supplementing vitamin D if you don't have enough. You need to start supplementing microcrystalline hydroxyapatite. If you can't find it, call my office. I'll give you the number later and I'll be able to supply it for you. And the butter oil is an important supplement as well. Now, ask your doctor also to check your estrogen, progesterone, testosterone, and DHEA. Chances are they'll all be low. There's a good chance also that your doctor will say, you don't need these hormones, you're too old to check them. If that's the case, if you're having difficulty getting your doctor involved in helping you, call me. I've treated thousands of women and men over the years with low hormones, with osteopenia, with osteoporosis, and I can help you as well. My number is 718-769-0997. I can have a phone consultation with you. I have it with people all over the country and, in fact, all over the world. And I can arrange for you to have a blood test and whatever treatment you need, I will arrange for that. So 718-769-0997. Please don't forget to like this channel and to subscribe. Don't forget to look at my other videos and like them as well. I'm Dr. Michael Teplitsky, wishing you the best of health.